All right, in your warrior two, hands to the pelvis, groins go back. When you bring your groins back, it does rotate the femur slightly inwardly. So what you'll have to do is lift your right heel up and then move your heel to the left. So your shin starts to rotate to the right, and it should pull your femur bone out to the right as well when you do that. And all that's really coming from the hip joint, but if you think from your shin, you can see the knee rotates back to the right. Okay, now press down to your right heel, specifically your outer heel, and drag it back. That's gonna really target the biceps femoris muscle to get this rotation of the shin. Now, if you get too much rotation and it feels like you're torquing your knee, again, reduce what you're doing or change to the opposite. You could always try, what if I pull back from my inner heel? Does that feel better? Or the center of the heel. So if you think from the outer shin pulling back, that's external rotation of the shin. If you think from the center of the heel pulling back, that's gonna be no rotation of the shin. If you think from the inner shin and inner heel pulling back, that's gonna be isometrically internally rotating. Those are your three choices at the knee joint right now. You could also push the foot forward. That's gonna be quadriceps. Come into goddess pose. Move the groins back. So pelvis back, weight's more in the back of the or outer edges of your feet. And then here's a common scenario. A lot of people internally rotate their shins when their knees are out here. That often tends to be kind of tweaky on the inner knee, though if it's, works for you, no worries. Lift the foot up and rotate out for now. Rotate both toes out at the knee joint and think shins rotate out. How do we do that? We'll pull the outer heels toward each other. Think the fibula, which is the outer shin bone, pull it back towards each other. In this case, so the outer shins pull back, or you can think in, towards the midline, and that will help you with the rotation of the shins outward. Scoop the tail slightly right now, so a little posterior tilt, a little extra posterior tilt, but keep the pelvis back. Shins rotate out, outer heels pull back, which is what we're gonna do when we get to half lotus. We're gonna pull the outer heels back, try to target the biceps femoris, knowing, of course, that you could pull the inner shins back. So if anything's tweaky on the knees when I say pull the outer heels in or back, then think inner heels in or back and see what happens there. So let's step into Massana Squat pose. Place the forearms on the inside of your knees. You're gonna push out with your forearms so your hips lift up, and you'll feel a nice stretch in the adductors. A little tuck of the tail, and then squeeze your knees into your arms gently. And if you notice right now, the toes are facing the same directions as my knee cap, let's say. So my femur is pointed out to the left. My shin and toes are trying to face the same way, so I just adjusted my foot slightly. Being aware of which direction your shin is facing and how your thigh bones are aligned is super important to the health of your knees, making those choices. It's not that you can't turn your feet in, you totally can with the knees out to the side. Just understand that that's medial rotation, so my feet are currently turned in, medial rotation, and that just puts a little bit more potential pressure on the inner knee. But it might be a good thing to do that every now and then, or depending on your knee joint, might be a good thing regularly. But for most of us, no rotation kind of ensures that we're not putting any torque on the knee. Let's take 2 blocks. We'll start our exploration here with our figure 4 pose. It's a good one because it puts a lot of pressure on the knee. If you look at your shin right now, you should see there's pressure more on the inside of the knee because of the way that the ankle on this knee is pressing up, and so the shin is getting kind of pushed and tweaked into that knee. So what I try to do is roll the calf muscle forward, which is external rotation, or think turn toes of the right foot down, tibia down towards the ground, but roll the right thigh bone out to the right at the same time. So you want to increase the space right at that inner knee. You want to spread the space. I'm not saying that it's the answer all the time to externally rotate the knee. It may be the opposite. It may be that you need to internally rotate, but just logically speaking, to maintain external rotation of the shin and external rotation of the hip joint when you're in a posture like this would more often than not keep the knees at less risk. We're gonna take half lotus on our back. I'm gonna show you that before you get into it, okay? So watch me. To get into this pose, you take half happy baby. First, you gotta learn how to do half happy baby with external rotation of the thigh bone. So rotate the thigh bone out to the right, and then bend the knee. So what most people do when they do half happy baby or happy baby is they keep the knee turned in as they grab the foot, and they do something like this. Foot is kind of everted. Watch how I grab the inner heel. I'm gonna do, sorry, inverted. Evert the ankle and spin and widen the knee. You can take this hand and widen the knee out to the right. Really not much more is needed except to flex the knee, and I'm already in half lotus. So watch this. I'm gonna bring my left knee across, and now I'm in half lotus pose. Okay, if I wanted to go more, I bring this heel to the groin and I twist the whole body over and come back, and now I'm in a half lotus pose, and for now I'm keeping a flexed foot.